Hello and welcome. My name is Dr. Treasury. It's lovely to meet you. I have you booked in for an ASMR cranial nerve examination today. Is that what you were expecting? That's right. It's a detailed medical examination with some extra tingles thrown in there for good measure. Good. Okay. Why don't you tell me a little bit about what's been going on and what symptoms you've been experiencing, just while I put some hand sanitizer on my hands. Okay. And when did that happen? Okay. Right, I see. And how are you feeling right now? Any dizziness at all? Okay, fine. So it's a minor road traffic collision and just some headache since and a bit of difficulty sleeping. Those are the main issues. I understand. Okay. Well, the purpose of this assessment today is just to make sure that there are no issues with your nerves, especially in your head and your neck area. We want to check that everything is functioning as we would expect normally, so there are quite a lot of tests to go through, and I will need to get quite close to you at times if that's alright. Good. It shouldn't be at all uncomfortable, but if you do feel discomfort at any point, just let me know. Okay? Good. I'm just going to put some gloves on a moment. That's it, just make yourself nice and comfortable there. Wonderful. Okay. I'm going to begin then by examining your face, the skin on your face and your neck. I'm just going to touch a few different areas and I'm going to see how it feels to me, but I'd like you to let me know if there are any areas that feel particularly tender or have any kind of an unusual sensation with them. So perhaps if you notice any kind of pins and needles or numbness, if you can't really tell that I'm touching your face, just let me know, okay? That's it. Alright, I'm going to begin then on your forehead. I'll just work my way across towards your left temple here. And over towards your right temple. How's that feeling? Normal sensation? No soreness at all? Good, okay. Let's move on to your cheeks then and your cheekbones. How does that feel there? Just on this side here? A little bit of tenderness there. Yeah. Okay. What about on the left side? How's that feeling? Normal. Okay, good. I'm just going to have a feel around your eye sockets quickly. your brows. Okay, and just down your nose. Is that okay there? Did you bump your nose at all? Okay. Did you have a nosebleed? Alright, okay. We'll look in there shortly. I'm going to move down now towards your jaw area. Okay, so that's it. Just relax your face down for me. Very good. Okay, I'm just going to run my fingers along either side of your jaw. Very good. Towards your chin. And around your mouth as well. Okay, I'm going to place my hands either side of your jaw, and if you could just open your mouth wide for me. Very good. And now close again. Great. Okay, I'm just going to press here. And here. And here. And down onto your cheeks. Any numbness at all, any tenderness or unusual sensation in the skin on your face as I'm pressing? Okay, so it's just that area around your right cheekbone where it's a little bit sore. Okay, fine. I'm just going to press down now onto your neck and check there. Okay, so just around the left side here. And the right. Just also going to feel your lymph nodes. That feels all normal to me. Okay, we will investigate the right cheekbone a little further. What I'm going to do now is I'm going to check your muscular function in your face. So I'm going to ask you to do a few things for me which might seem a little strange, but it's just checking out those muscles, okay? Lovely. Okay, if you could begin then by puffing up your cheeks as much as you can, like a squirrel in winter. Beautiful. Okay, and then a lovely big smile for me. Perfect, and with your mouth open so I can see your teeth. That's it, lovely, and relax your face down again. Okay, now I want you to squeeze your whole face tight, like really tightly, eyes closed. Scrunch your face up for me. Excellent, and relax it all down again. Okay, very good. I would like you to please stick your tongue out for me as far as you can. Very good. And then back into your mouth with your tongue. I would like you to lift it and touch the roof of your mouth. Excellent. Well done. Okay. Can you move your tongue left to right for me? Very good. Okay. Now relax your jaw down normally. Leave your mouth closed if you prefer. That's it. Well done. Okay. I'm going to now press my hands onto your shoulders. I'm going to press down, and I would like you to try to lift my hands up. So lift against the resistance of my hands. Okay, so just here on your shoulders. And lift, lift, lift. Very good. Okay, and I'm going to do the same on your hands. So I'm going to place my hands on top of yours, and I just want you to lift up against my hands. Very, very good. And now I would like you to grab hold of my fingers with both hands at the same time and just give my fingers a squeeze, okay? That's it, well done, and squeeze. Very good, well done. Okay. I'm going to place my hand, now the palm of my hand, on the left side of your face here, and I would just like you to lean into my hand as I press there. That's it, lean, 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 very good. And the same on the right side, now just pressing my hand against your cheek and lean, lean, lean for me. Good. I'm going to place my finger underneath your chin with your mouth closed, and then I want you to try to open your mouth for me, okay? Okay, so try to open. Very, very good. And I'm going to place my hand at the back of your head, and I want you to lean back into my hand as I'm moving your head forward. So just come around here, and that's it, just lean into my hand there. Very good. I'm going to place the heel of my palm onto your forehead, and I want you to lean into that. Press. That's it, press, press, press. Very good. And now with your eyes tightly closed again, I'm just going to try to open your lids, but I want you to resist, okay? So close those eyes for me nice and tight. That's it, and just resist, resist, resist. Very, very good, okay? All functioning normally there, so I am just going to test your blink reflex, so good. Very good, okay. Okay, that's good. That's it. And if you could please blink for me 3 times when I say blink, okay? So blink. Okay, and now I want you to hold them closed for me. So blink and open, blink and open, blink and open. Very, very good. That's perfect, well done. So it seems as though all the muscles in your face are functioning normally. And just to finally test out those sensations, what I need to do is use this little brush here, which has one soft end and a slightly sharper end. It's not too pointy, but in contrast this is very soft. So I'll just show you how that feels. So this is the soft side, like that. Can you feel that on both sides? Okay, and this is the sharp side. Just like that. Can you feel the difference? Okay. So with your eyes closed, that's it, just close them down for me. Very good. I'm going to touch on your face in different areas, and I would just like you to tell me whether you experience a soft or a sharp sensation. Okay, so here we go then. Is that soft or sharp? Great, and same again. Was that soft or sharp? Good, and of course if you feel nothing at all, do just tell me, okay? Soft or sharp? 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 time? Was that soft or sharp? Very good, okay. I'm going to use the sharper end of the brush now with your eyes still closed. I would just like you to tell me how many times you feel this touch your face, okay? So I'm going to start now. How many times was that? Okay, and how about now? How many times was that? 4, very good. And how about now on this side? Okay, shall I try that one again? Ready? How many times was that? Okay. How many times was that? Okay, and last go. How many times was that? 3, very good. Okay, with your eyes still closed, I'm going to take the tip of a pen. I'm going to leave the lid still on, but I'm going to trace a couple of letters into your forehead, and I would just like you to tell me what letters you feel, okay? Okay, ready? So what letter is this? What letter was that? It was H, well done. And how about this? What letter is this? That was S, well done. Okay, what about this letter? E, well done, very good. And the final one, what letter is this? Shall I try that one again? Okay, here you go, what letter is this? It was T, well done, very good. So I would suggest that the sensation in your skin is normal. You do appear to have a little bit of numbness, a slight reduction in sensitivity around that cheekbone, but I think if you've damaged it, that's probably why. Okay, good. Right, let's move on then to the next section of the test. I'm going to move on now then to looking at your ears and thinking about your hearing. So first of all, have you noticed any changes in your hearing since the road traffic collision? Okay, so any inner ear pain, any muffling at all? Okay, how about any ringing in either ear? And have you noticed that you felt at all dizzy at times, like it's difficult to stand up, or if you stand up suddenly you lose your bearing? Okay, and have you noticed any difference in one ear compared to the other? Alright, well, I'm going to begin by using this otoscope, and I'm just going to place it into your ears and look inside your ear canal to see what's going on, okay? Alright, so it might feel a little bit cold, but it won't be uncomfortable. Okay, here we go, so just inside your left ear initially. well done. I will look in your right ear now. Okay. See what's going on here. Are you okay there? Is that a little bit sore on that side? It is, yeah. Okay. So it does look slightly inflamed in here actually, compared to the other side. You do have some redness there. It's clean. It's very clear, but there is a certain amount of inflammation which I think we needed to address. So I'll make a note of that. Okay. Alright. Well done. I hope that wasn't too uncomfortable for you. Good. Pop that one there then. So what I'm going to do is check your hearing and let's see if there's any kind of difference between the two. Okay. Start with your left ear then. I'm going to just make a sound in your right ear, but I'd like you to repeat back the number that you hear in your left ear as I do, okay? Like this, okay? So 432. Very good. 67. Very good. 123. Good, well done. Let's try the same on the other side. 99. Very good. 742. Very, very good. 289. Good, okay. Was it any more difficult to hear with that ear? No? Okay, that's very good. Alright. So I'd like you to close your eyes for me again a second. That's it. And now just tell me which side of your head you can hear the sound coming from, okay? Good. Very good. Okay. Good. Good, well done. That was really good. Okay. Keep your eyes closed for me. I'd just like you to tell me how many taps you hear. Okay. Good. Very good. Good. Okay. Okay, well done. Keep your eyes closed for me, and I would like you to tell me where the sound is coming from. So is it on the left side, the right side, above or below? Okay. That is below, well done. Above your head, well done. That is on your right, well done. On your right again, well done. That is on your left, okay. Good, that was above your head. Okay, so it seems we don't have any issues there with your hearing generally. I'm just going to check a couple of different frequencies with these tuning forks that I have. So I have one at the lower end of the spectrum at 285, and then I also have one at the higher end of the spectrum, and that is at 741. So if you could just tell me first of all, can you hear this sound? Could you hear that in both ears? Good, okay. So again, with your eyes closed, I would just like you to tell me which ear you are hearing the sound in, okay? Good, well done. Very good. And now if you could tell me which direction the sound is moving. So does it move from above your head to below? Does it go from left to right, from right to left, or from below to above? Okay? Good. Very good, that was your right to left. Good, that was left to right, well done. That was below to above, very, very good, okay. Now I'm going to try this same quickly with the higher frequency. If you could just let me know if you can hear this one. Yeah, very good. Okay, so just tell me which ear then you are hearing it in. That was the left ear, well done. Good, yes, left ear again. And your right ear, well done. Okay, and now tell me which direction you can hear the sound moving to and from. Good, that was beneath you to above your head. And how about now? Well done, that was from your right ear to your left. Very good, that was from your left ear to your right. And now if you could just tell me which ear you hear the higher frequency in. Which ear has the higher frequency? It was your right ear, very good. And same again, tell me which ear has the higher frequency. It was your left ear this time, well done. Okay, that's great. So although you have some inflammation in your right ear and your right jawbone is a little sore, it doesn't seem to have affected your hearing at all, which is quite reassuring. That's it, okay. So I'm going to do an examination of your nose now. I'm just going to use the otoscope for this again. So I'd like you to just tilt your head back for me slightly. That's it, okay. I'm just going to have a quick look inside both of your nostrils. So starting with your left one there. Okay. Looks all normal in that one, and your right nostril. Beautiful, okay, they look normal. Have you had any trouble breathing, any breathing difficulties since your road traffic collision? No? Okay. So what I would like you to do is take a deep breath in for me with your mouth closed, so it's just through your nose, okay? So breathe in and out through your nose as well. Very good, well done. Now I'm just going to hold your right nostril and I want you to do the same again, but just through your left nostril, okay? So breathe in for me. And out through your nostril. Well done, and just the same on the other side. Breathe in through your nose. And out. Very, very good. Okay, that seems to be normal. So it doesn't sound like there's any kind of blockage or obstruction there which could be affecting your breathing, so that's really good news. Sometimes if you have an injury somewhere in your cheek there, it can cause an issue, but it doesn't appear to have done so. So what I'm going to do is I'm going to test your sense of smell as well, just to make sure your olfactory nerves are working as we would anticipate. Great, okay. Now, do you normally have a fully working sense of smell? Okay, and have you noticed any changes in that since your road traffic collision? You haven't? Okay, that's good news. Well, I have some essential oils here. They are quite strong but also quite recognisable scents. So I'm just going to waft a couple in front of your face and see if you can pick up what those aromas are. Okay. Okay, let's have a look at this one first. I'll try not to show you the label and give it away. So I'm going to start quite far away and move it towards your face, and what I'd like you to do initially is just tell me when you can smell it, okay? Just say when. Okay, here we go, so just tell me when you can smell it? There, lovely. Now have a little smell of that one and see if you can identify what that smell is. It is mint. Well done. That one is peppermint. Okay, that's quite a strong smell. Okay, and same with this one. Just let me know when you can smell it. This one's not quite as strong. There, that's it. Okay, so can you tell me what scent that is? Do you recognise it at all? Okay. Yep, it is citrusy. No, it's not lemon. Try again. It is orange. Well done. Very good. Okay, and finally, this one here. Let me know if you can tell what this scent is. So let me know firstly when you can smell it. There, okay. Just take that one in for a moment or two. Let me know if you recognise the aroma. It is lavender. Well done. Okay, so that one has the added benefit of being quite relaxing. There we go. Okay, so I'll pop those ones away. Okay, so I am satisfied that your olfactory nerves are working as they should be. There seems to be no issues there. So I'm going to move on now to checking your eyes, your vision. And I'm going to begin by asking a couple of questions, if that's okay. Good, okay. So you're not wearing any glasses today. Do you normally have a prescription or do you ever wear glasses? Okay, fine. And have you noticed any changes in your sight since you've had the road traffic collision? Okay. So any double vision at all or any blurriness? And are you struggling to do things you would normally do, like reading for long periods of time? Do you get headaches or anything like that? Okay. And what about your colour recognition? Have you noticed colours look any different to normal? Okay, lovely. Well, I'm just going to shine this little light in your eye, if that's okay. It's not too bright, but it's just going to allow me to have a deep look inside your eye there. So let's have a look at what's going on there. Okay. Just having a good look. At your left eye first. switch then to the other eye, to your right eye. That's it, just stay nice and still there. Okay, could you just look over to the right side of the room for me? Good, and across to the left side. That's it, and just look down for me as well. Okay, I'd just like you to do the same on this side again, so look across please if you could to the left side of the room for me. Okay. And to the right side. And look down for me as well. Okay, that's brilliant. Well done. So just pop that one back over there as well. And I'm just going to do a couple of things to check your vision. Okay, so I'll just grab these here. Okay, so I'd like you to sit up tall for me. Relax your shoulders down, and then I'm just going to use a pen light. It's not too bright, but it is quite bright, so if you need to rest, let me know. And what I would like you to do first is try not to focus on the light. So try to keep looking straight forward, focus at my face or my nose or at a point directly behind me. And all I'm going to do is place my hand in front of your face here, and I'm going to swing the light into your field of vision like so. Okay. Good. Just keep looking at a point around or behind my head. Try not to get distracted by that light. Just looking here to see how your pupils are reacting on both sides. Seeing if they're doing the same, or if one reacts differently compared to the other. Okay, good. So focus again on my nose, and I'm just going to move the light in front of you, but I don't want you to look at it. If you can, just keep looking at my nose. That's it, well done, you're doing fantastically. Okay, very good, and this time I do want you to focus on the light. So you're going to keep your head nice and still, and you're going to let your eyes do all the work. So when the light appears in your field of vision, that's it, just focus on that light, and now just follow it with your eyes. on that light. Very, very good. That's great, well done. Okay, now looking straight at me again, I just want you to tell me what side of your head you see that light appear on. So is it appearing on your left side or your right side? Okay. Good, keep looking straight at me, don't look at that light, I'm just checking your peripherals here, okay? Good. Very good. Okay, and also above or below. Very, very good, well done. I'm going to ask you to focus now. So I won't use the light for this one, I'm just going to use the tip of my pen just to check what colour is this pen. It is very good, okay. So in a moment I'm going to ask you to shift your focus to the pen. But for a minute I would like you to look directly at me. That's it, good, okay. And now look at the pen. And now back at me. And now back to the pen. Very good, okay, same again. So look at the pen. And back to me. And back to the pen. Okay, and now would you look at my nose and see if you can focus on the pen. And back to my nose. And back to the pen. Okay, very good. And same here, if you could please focus on my nose. And now the pen. And back to my nose. And back to the pen again. Good, okay. I'm going to do the same peripheral test, but with my fingers this time instead of the light. So I'm going to hold my hands, my fingers just out in your peripherals, like that. And I want you to tell me on which side of your head you can see movement, okay? That's it, just look right at my nose. Okay. That's it, keep looking at my nose and just let me know which side of your head you see movement on. Well done. And same again. Okay. Very good. Excellent. And then the last little test. Good. That's great. So let's move on to looking at an eye chart now. So firstly, I have my pen here. I'd just like you to tell me what colour is this pen lid. That's right, very good. And I have an eye chart here. So I'd just like you to tell me, what colour do you see here? Excellent, okay. And right next to it, what colour do you see here? Good, okay. So I'm just going to hold this chart here, and I would just like you to tell me what letter I am tracing, okay? So what letter is this one? Good, okay. And how about this one? And this one? Okay. Can you read this one? And this one? And how about this one next to it? Okay, so a little bit more difficult now. Can you read this one here? Okay. Yes. Very good. And finally. Okay, and can you read this line to me here? Can you read any of those letters? Good. And this one? How about this one here? What about any from this bottom row? Can you read any of those letters? Okay, well done. So I'm just going to take my gloves off, and I'm going to check a couple of other things with some vision cards that I have. So firstly, on this card, I would just like you to tell me, what can you see in this picture? Good, okay, so can you see a young lady in this photo? And can you see an older lady in this photo? See if you can switch your vision between the two. Okay, so this is the young lady, the side of her face here and her ear. She's got a little feather coming out of her head, her hair, and she's looking away so you can see the side of her face there. Those would be her shoulders, and it looks as though she has a little necklace on of some sort. There we go. And then the older lady, this would be her nose, and this line here is her mouth. It's her chin coming down here. Can you see that as well? Good, well done. Okay. And I would just like you to look at the image on this card now. And I would just like you to tell me how many complete circles there are. How many circles which are not overlapping. Have a look and see if you can count the circles. Okay, so we have one here. And this is also a complete circle here, that's number 2. We have number 3. have number 4 on the edge. Sometimes the way that this is drawn, it makes the circles look as they are all overlapping, but they are actually not. Can you see that? Good. Good, well done. Okay, and then finally, in this image here, which of these squares is lighter? Is the top square lighter or is the bottom square lighter? Can you see a difference at all? Good, okay, so this bottom square does look lighter, doesn't it? But if I cover that middle line, they are actually the same shade. It's a bit of an optical illusion. Can you see that there? Good, well done. Great. So your eyes are reacting normally to those vision cards, which is a very good sign. I'm just going to pop my gloves back on so that we can move on to looking at the final portion of the test, which is your mouth, your sense of taste. Okay, so firstly, just when I do that, have you had any issues lately with swallowing when you're drinking water or anything like that? Has it caused you any kind of issue or soreness at all? No? Swallowing normally? Perfect. Okay. Right, well what I'm going to do is I'm going to begin by having a look inside your mouth. So have you had a dental checkup recently? About 5 months ago, so you're due one soon, okay? And were there any issues at your most recent dental checkup? Okay. And again, since your road traffic collision, have you had any issues with your mouth, any tooth pain or anything like that? No? Okay, lovely. Right. If you could just open wide for me. I'm just going to have a look inside your mouth here. Okay, sorry, I just need to hold your lip down there if that's okay. That's it, you can allow your tongue to relax, that's fine. Good. Just looking around your teeth, your gums to see what's going on. Going to look at the top as well, at the roof of your mouth. There, that's it. Okay. Now if you could stick your tongue right out for me again, just say ah. Okay, just looking right at the back of your throat there. We won't be much longer, don't worry. Lovely. Okay, you can pop your tongue back in and then just lift it up to the roof of your mouth for me. Just so I can look under for a moment. Okay. That's all looking perfect to me. No issues there at all. I do just want to check your sense of taste. So, have you noticed yourself any changes in your sense of taste? Even a loss of sense of taste? So when you're eating, drinking, anything tastes differently than normal or no flavour at all? Okay. So I have these little atomizers here. Each of them has a different flavour in, a little mist that's flavoured It's sugar-free and no calories and nothing harmful in there at all, of course. And don't worry, the colours don't give away what the flavour might be, so don't be confused by that. But all I'm going to do is just ask you to open your mouth. I'm going to spray a couple of sprays into your mouth, and then I'd just like you to have a little think and let me know what you can taste. Okay? Lovely. Are you ready for the first one? Good, okay, so just open your mouth for me there. That's it, and I'm just going to spray this one in. Just have a little taste of that. And what do you think that flavour might be? It was chocolate. Very, very good. Okay. And now this one here. Alright. Apologies if you don't like any of these, but it's really just to make sure your sense of taste is working normally. That's it. So just open your mouth wide for me again. You can stick out your tongue if you like. That's it, good. Good, okay, have a little think about that one. Recognise that one straight away. Coffee it is, okay. Okay, last one then. If you could stick your tongue out for me. Okay. What do you think that one might be? Yes, it is strawberry. Well done, very good. Not everybody gets that one because it's quite difficult, isn't it, when you can't see any kind of colour or what's going into your mouth. That's it. Great. Okay. I am satisfied with the tests that we have undertaken today and the results that we've had. I don't think there are any issues with your nerves at all. However, I would like to send you for an X-ray in terms of the damage that you've sustained to your cheekbone there. I think we should just have a look and see what's going on in there. And I think it might be why there is some pain and some issues in your ear. Okay? That's it. We'll have a look at that first and then we can decide what to do from there. I also think it might be worthwhile signing you up for an eye test if you haven't had one for a while. Your issues with headaches and things that you've been having could be coming from vision and needing a prescription perhaps that you haven't been wearing, so it's best to rule that out first. It could also be, of course, as a result of the injury, but we'll know more once we have your X-ray results back, so we'll go from there first. So an X-ray and an eye test, and then we will meet again to decide what our next steps are. Okay? Lovely. Well, it's been a pleasure to meet you today. You've been a wonderful patient. I hope that it hasn't been too strenuous for you and that you are now off to do something nice and relaxing with the rest of your day. Good, I'm really pleased. Okay, great. Well, I will catch up with you again very soon. Take care of yourself.